Before taking resting blood pressure, patients should be allowed to rest for at least 5 minutes. The use of caffeine and nicotine 30 minutes before testing is not recommended. The cuff should be the proper size, fitting at least 80% of the individual's upper arm. The patient being tested should be seated properly, with their back supported, their feet uncrossed, and their arms at heart level. If the individual is wearing a long sleeve, roll up the long sleeve so that the measurement can be taken directly on the arm. Next, be sure to have the proper orientation set on the prongs of your stethoscope, facing away from you. The diaphragm of the stethoscope will be placed on the brachial artery of your subject. Use of proper cuff size is important when taking blood pressure. The bladder of the cuff should cover 80% of the upper arm of the individual being tested. The cuff should be placed with the artery mark over the brachial artery. Remember to wait at least 1 minute between measurements when performing multiple blood pressure measurements on the same subject. Once the cuff is secure and in place, the cuff will be inflated from 180 to 200 millimeters of mercury. Depending on the arm size of the individual, this number will vary. Once the cuff is sufficiently inflated, you can use the valve to begin releasing the pressure at a rate of 2 to 3 millimeters of mercury per second. While you are releasing the pressure from the cuff and the diaphragm of the stethoscope is over the brachial artery, you will listen for the Karatkov sounds to denote the systolic and diastolic blood pressure. A tapping sound can be denoted as the systolic blood pressure when listened through the diaphragm of the stethoscope. The disappearance of the sound can be denoted as the diastolic blood pressure. Classification of blood pressure for adults is as follows. A normal adult would have a systolic blood pressure of less than 120 millimeters of mercury and a diastolic blood pressure of less than 80 millimeters of mercury. A prehypertensive adult would fall in the range of 120 to 139 SBP or 80 to 89 DBP. In stage 1 hypertension, SBP falls between 140 and 159 or 90 to 99 dBp. Stage 2 hypertensive adults have a systolic blood pressure equal to or greater than 160 millimeters of mercury or a diastolic blood pressure greater than or equal to 100.